so many doctors afraid of hormones? It's Dr. Deb here, and the reality is doctors actually commonly are afraid of hormone therapy. They'll prescribe antidepressant medications and pain medications and all kinds of other things that have potentially really significant side effects. But when it comes to hormones, doctors are scared, and they often end up scaring their patients away from hormone therapy, leaving women to suffer unnecessarily from symptoms that we could have resolved quite easily if we got the hormones balanced. So why is this? When I was in medical school in the 1990s, we were taught that hormones were the greatest thing since sliced bread. We were taught that all women should go on hormone replacement therapy for their own good because it was going to prevent heart disease and dementia and osteoporosis. It was going to help them to live longer and to have healthier lives. But all of that changed in 2002 when this great big study was released. It was called the Women's Health Initiative Trial, and it was supposed to prove once and for all the benefits of hormone replacement therapy. And unfortunately, it got cut short. They stopped it prematurely because in one section of the study, we found that there was an increase in the risk for breast cancer. And because as women we're scared of breast cancer, that was a really big deal for us. But it was also really a big blow for doctors because one of the very first things that happens, like literally on the first day of medical school, is we take what's called the Hippocratic Oath. And part of that is first, do no harm. So doctors absolutely do not want to do anything that is going to put their patients at risk. And so what we were being told is that we were telling all these women to go on hormone therapy and we were causing women to have breast cancer. We were horrified. But that was 20 years ago, and we've had 20 years to really understand that that's not exactly what the study showed. In fact, women in the study who were on estrogen only didn't have an increase in the risk for breast cancer at all, no matter how old they were. It was only women in the study who were given a combo pill with a synthetic form of progesterone called a progestin. Those women had a very tiny increase in the risk for breast cancer. But if we give you the natural form of progesterone, we don't see the risk for breast cancer. So now we know that it is possible for us to give you hormone replacement therapy without increasing your risk for breast cancer. We know that there are ways that we can do it that can get you lots of benefits and really minimize the risks. But doctors haven't all kept up with the latest research. They got so traumatized by this idea that we were increasing the risk for breast cancer that they just can't get past that. Even doctors who are interested in learning about bioidentical hormones are still scared of hormones. And sometimes when I'm working with doctors and training them and helping them learn how to do this, they have a lot of work to do to overcome their fear of estrogen, even though it wasn't even estrogen that was increasing the risk for breast cancer in the first place. So it's confusing for doctors, just like it can be for patients. And doctors always want to err on the side of do no harm. So in some cases, they feel better telling you not to be on hormones than they do to prescribe you hormones. But that's backwards thinking. There are so many benefits to hormones that are so important for women. You know, in Britain, women are all offered hormone replacement therapy. And of course, they use bioidentical hormones because it's really only in the United States that we're sort of stuck with these synthetic hormones because of the pharmaceutical industry influence. But in the UK, women are all offered bioidentical hormone replacement for free, because they know that it's going to keep women healthier. It's going to save their healthcare system a ton of money because less women are going to break their hips and have dementia and be frail, etc. So women in Britain can get hormone replacement therapy for free because they know about the tremendous benefits of hormones. We're not there yet here. I still talk to doctors all the time who are afraid of prescribing hormone therapy. Most doctors weren't properly trained at how to prescribe hormone therapy. So one gynecologist recently told his patient that he doesn't do that and he's not going to learn a whole new specialty. He's a surgeon and he doesn't want to be bothered with it. We had a gynecologist who used to refer patients to our practice because what she told us was, I'm a surgeon. I don't want to have to deal with those hormonal women. So you think that your gynecologist is the one that's going to help you with this. And of course, many gynecologists can, but it's not always true. So here's the deal. If your practitioner does not feel comfortable with hormone therapy, if they are trying to dissuade you from being on hormones, that's not the end of the line for you. You can find another practitioner who can help you. There is no need for you to put up with symptoms. You don't need to become a frail little old lady. You can have the benefits of hormones. You just need to find the right person who's willing to work with you so you can love the way you feel.